So this was, and actually this policy briefing was recorded, so you can actually go online and listen to the whole thing if you're interested. It was a very high level briefing. We had a discussion really of this large concerning issue that 3 million veterans during the global war on terror were exposed, this is in Iraq and Afghanistan, were exposed to toxic burn pits. And a really extraordinarily large number of them have subsequently reported diseases of various sorts. And one of the things that has befallen them in very large numbers is chronic migraine and chronic headache disorders. And so we had a keynote address by Representative Mark Takano, who is the chair of the House Veterans Affairs Committee. So that's a very high level person who acknowledged during the briefing that he actually has migraine and he finds this debilitating and he understands this issue. We also had John Stewart, who has been a champion for this issue for veterans, as well as two extraordinary 9/11 first responders, John Field, who is this gentleman, and Joe McKay, who is this gentleman who has cluster headache, who spoke very passionately and eloquently about how much impact this is for veterans. And the gentleman in the bottom here, that's Dr. Jason Seco. He is the National Director of the Headache Centers of Excellence for the VA. Paula Dumas was one of the key moderators for this event. So this was a very high level event, which we were very proud of as well. And move on. So Headache on the Hill. So this was our first Headache on the Hill in 2007. And one of the reasons I decided to show this photograph again is that this person here is Eileen Jones. And this was the event that inspired her to organize the first Miles for Migraine run. And she's a very passionate advocate. But Headache on the Hill has grown very substantially since 2007. Our 2021 event on March 23rd was held virtually. So this is what one of the groups from California looked like. And we have almost 5 times the number of participants, and the participants have shifted very substantially from very few patients up to most, the majority are patients who have migraine. We reach almost every state, 47 of the 50 states. And at the initial Headache on the Hill, we had meetings with a quarter of all of the congressional offices. And for the first time this year, we had meetings with more than half of them. So about a third of the House offices and almost all of the Senate offices. The scale of this, just to give you a comparison, puts Headache on the Hill in the same, almost the same sort of scale as the biggest of the disease-oriented advocacy Hill days. So for heart disease or whatever, to be able to reach half the offices in a day is really a very big impact. And we're extremely proud of and excited by our advocates who have shown their passion in these meetings to an extraordinary degree, and the numbers bear it out, which I'll show you in a moment. So we had 2 asks. One was about the VA. So I mentioned that headache disorders are a major problem for veterans. Almost over a third of a million veterans sustained traumatic brain injury during the Iraq and Afghan campaigns, and nearly half of them have chronic headache disorders. And 3 million of these veterans were exposed to these burn pits. And the evidence is that for people who are exposed, there is a substantial risk they will develop functional limitations due to migraine. Why this is true isn't clear, but the numbers are pretty stark. And within the VA system, which is only about a third of all veterans are actually being cared for by the Veterans Health Administration, but about a million of them at a minimum have headache disorders. In 2018, we worked with Senator Brian Schatz to establish the VA Headache Disorder Centers of Excellence to provide specialty care for veterans who have disabling headache disorders with a focus on traumatic brain injury. And there was a $10 million appropriations that were secured at that point to establish at least 5 of these centers. And since that time, there are now 14 of these centers, but there has not been an increase in the appropriations to support those 14 centers. And furthermore, Dr. Seco, who is, again, the director of this program, his analysis is that about over 400,000 veterans are seeking specialty care, consultation care for headache disorders each year, and only half of them have access to these centers. So our big ask this year for the VA was to increase the appropriations from $10 million to $25 million a year, to expand the number of sites from 14 to 28, so every veteran has access, and to change the administration, which this is a technicality, from physical medicine and rehabilitation to neurology, to improve the administration of this, and also to have some specific support that these centers would be sustained in their support by Congress. On the NIH side, this is really the ask that started Headache on the Hill in 2007, and it hasn't stopped being an important issue. So headache disorders, everybody in this call is well aware, has an extraordinary impact and burden on Americans. 60 million Americans will have migraine this year. It's the second leading cause of global disability. For cluster headache, it's about 500,000 Americans, but it's really reputed to be the most severe pain humans can experience. And unfortunately, opioids are linked to headache disorders, even though they're rarely effective, and they, of course, pose a risk for opioid use disorders. And so trying to find better therapies is really an important issue to try to avoid opioid use disorders as well. And so just a word about this, this graph, which many of you have seen before, because I tend to put it in front of people whenever possible. So just a little bit of a word about this. So on the bottom side here of disease burden, this is a way of measuring how many people have it, how many people die from it, and how many people are disabled by it in one composite number. And each one of these blue dots is a different disease. And on the vertical axis, this is increasing amounts of NIH funding in 2015. So diseases which are over here are highly burdensome, but not getting much funding. And diseases up here are those that are burdensome, but are getting more funding. And the purple line running through the funding for migraine in 2015, all the other blue dots on that line have approximately the same impact or burden, but different amounts of funding. And what you see is this purple line is the best fit for the relationship between the burden and the funding. And where these purple lines meet is what we would guess would be equitable funding, fair funding for migraine if burden was the only consideration. Now, that's not the only consideration, but if it was, we would expect migraine to receive approximately $300 million in funding. And it's receiving, at least in 2015, it received $20 million. So we have a very, very far way to go. In 2016, we again worked with Senator Brian Schatz to draft and enact a law called the Stop Pain Act. And this authorized NIH to focus on pain research and opioid research, but in particular to understand pain and to develop new therapies that are effective for pain. And we were able successfully to put this blue clause in at the bottom, which said that in applying this statute, this authorizing statute, the burden of disease needed to be taken into consideration. But NIH has not actually done that. And Congress did appropriate and has appropriated for the last several years $500,000 per year or more to the end of improving research on opioid and pain issues called the Helping End Addiction Long-Term Initiative, or HEAL initiative. And unsurprisingly, perhaps, NIH has not chosen to focus on disease burden, and less than 1% of the funding that has been directed from this extra $500 million a year for research has actually gone to migraine and headache research from this HEAL initiative. So our big ask this year on the NIH side was to have a $50 million line item carve out from the appropriations, this $500 million or more. I stumble over the word billion, the $500 million or more that would be appropriated in fiscal year 22. All right, so where is the focus for Headache on the Hill? What are our advocates being asked to do? They're being asked to persuade their members of Senate and their members of the House, for whom they're constituents, to ask the committee that's responsible for appropriating funds from the federal treasury for these two areas, the VA and for the NIH, to ask them to focus on our requests. And for the NIH, there's a subcommittee of appropriations. This is going to be a brief civics lesson. Hopefully it won't be longer than is necessary. But there's a committee called the LHHS committee on both the House and the Senate side, which is responsible for appropriations which govern the NIH budget. And there's a different committee called the Milcon VA committee on both the House and the Senate, which is responsible for VA appropriations. So we asked our Headache on the Hill advocates, and we gave them specific information to provide to their members of Congress, to persuade them to tell these committees, make these requests of these committees to include our specific requests both for the VA and the NIH. And one of the key ways we do this is we try to find members of the Senate or members of the House to send a letter that's circulated either in the Senate or the House, which pulls together all this information so members of each body can sign it, and then it can go to these subcommittees to affect what we were asking for. And these are called Dear Colleague letters. And we were very successful at getting Dear Colleague letters for 3 of the 4 of these committees. So both of the House committees for NIH and the VA, and the Senate committee for the VA. We were not able to get a Dear Colleague letter for the NIH Senate committee. So once these letters and the requests go to these committees, the committees decide what information they're going to put in, and then they put this information into what's called the committee report, and then they vote on that. And then the next step is that information goes to the full appropriations committee, which is comprised of all of these 12 different subcommittees. They have to vote on that. And then it goes to the House and the Senate floor, and then they have to vote on that. And then that the bills, which are at that point usually not identical on the House and the Senate side, go to a committee where they hash out the differences and they reconcile them, and then they come up with a single bill, which then goes back to the House and Senate, and then that goes to the White House for signing. So it's it's arduous, it's kind of Byzantine what goes on. This happens every single year. And that's where we're engaged to try to influence this process at the very top, at the very beginning of this process. And that's why Headache on the Hill occurs in February or March every year at the beginning of this whole process. So at this point, these committees have met and voted. So we have this much of this process in. We don't have any of the votes on the Senate side. So anything that happens on the House side has to be also matched with the Senate side. So you can have wins on this side, and you can have not everything you want on the Senate side, or vice versa. And then ultimately in the conference committee, things get hashed out. So things are never over till they're over in this process. All right, so our Dear Colleague letters for the VA side, we were extremely successful at having a bipartisan letter. Senator Schatz, who's a Democrat, and Senator Cassidy, who was a physician, who was a Republican, led this letter. And we had 14 signers, so a total of 14% of all senators signed this letter. On the House side, we had 2 Democrats and 2 Republicans. Our stalwarts, Congressman Peter Welch and David McKinley, who's a Republican, who've been leading our letters for about forever together. They're really our champions, and you all should be aware that they've been in this together and on your behalf for a long time in a very unsung way. They get almost no credit for this, but it's really amazing how much they've contributed. And this year we have 2 new champions. We have Congresswoman Dean, who I mentioned earlier, and Congressman Brian Fitzpatrick of Pennsylvania. And we got 52 members of Congress to sign. This is about 12%. You have to understand, to get a handful of members of Congress to sign any of these letters is incredibly arduous. But to get in this range, 12 to 14% on either side is a big impact. We're actually making a difference here, and it's all because of the passion of our Headache on the Hill advocates to make the case to these members of Congress. And this is the outcome on the House Appropriations Committee, which came out 2 weeks ago, that you can skip down to this line: to ensure equitable access to specialized headache medicine services for all veterans that seek them. The bill includes $20 million for continued support of the active sites, as well as expansion to include at least 28 sites. So this is almost everything we were asking for. And on the Senate side, we're hoping we'll be able to get $25 million rather than $20 million, and then we'll go to the conference committee and maybe we'll split the difference. But even if we got just $20 million, that really is a big deal. And so we're extremely happy that we've had this much success, but the year is not over. It's never over until the president signs the bill. On the NIH side, we have the same core group of members of the House who have led the letter. It's very bipartisan again. And again, we had 47 signers of this letter, which is again 11%. And to give you a scorecard for this about how much Headache on the Hill makes a difference and why it's so important for people to show up and make the case, of the offices we visited, 32% of them signed one or both letters. Of the offices we didn't visit, and we haven't been able to visit, we only visited a third of all House offices, 1% of them signed a letter. So showing up makes a huge difference. This is not kind of a hypothetical, it's not a pie in the sky, gee, is this a worthwhile thing to do? It is very concrete. If you want to get members of Congress to sign on, you've got to persuade them. And the way you persuade them, sometimes you're able to persuade them directly, but usually it's a matter of making the case and persuading their staff. So this is a process that really is essential to how our government works, and we're right there trying to do this. All right, so we do have the House committee report language for the NIH. And we have some good news and bad news. The good news is that we have a very solid statement. The bad news is they did not include the $50 million. So there's a discrepancy that they left out the money. Um, but this isn't over. So the good news is that Senator Leahy, who is the chair of the Appropriations Committee on the Senate side, the overall chair, is our senator for Katie and myself. And we're hoping to have some influence in making a difference on the Senate side to get the money instated there. But if it doesn't happen, our advocates did everything that we could. We left no opportunity kind of undone to try to get this funding. So oxygen. This has been an agonizing, and in every sense of the word, but particularly for people who have cluster headache, agonizing issue. So since 2011, CMS, which is the Center for Medicare and Medicaid Services, they administer, it's this $1.1 trillion agency which administers Medicare and Medicaid. They've had a policy to not permit coverage of oxygen for cluster headache, which is absolutely the most effective abortive treatment for the most severe pain humans can experience. And it's air, and it's safe, and it's inexpensive, and they've been obstinate. And we've been at this collectively for a very long time. A large number of groups, I just listed some of them there, that have been vigorously working to overturn this. And in 2018, the Alliance for Headache Disorders Advocacy submitted a very clear formal appeal with new evidence that we had generated to argue against this continued unfair and cruel policy. And the good news is that only 15 days ago, a little over 2 weeks ago, they finally responded to our appeal, and they overturned the restriction. The problem is they didn't really overturn it with a kind of a full throat saying this is something which people with cluster headache should have access to. They tossed it down to some local administrative levels without an adequate amount of guidance for those other local administrative levels for Medicare. So we're still engaged in this. We're still concerned that we want to make sure that people with cluster headache will be able to have access to this, because it's not just, perhaps the, 40 to 50,000 Medicare beneficiaries who may have cluster headache that's active, but when CMS makes a decision about whether or not a therapy is valid or not, private insurers also use that as guidance, and they may rely on these judgments to decide whether or not they should cover it as well. So for the 500,000 Americans who have cluster headache, this is like an existential issue. You have pain. The only thing that'll will respond it'll respond to is oxygen, and for reasons that really defy logic and common sense, it's impossible to get for many people. And a large number of people have resorted to buying welder's oxygen, which is not medical grade and has hazards involved, because they don't get access to coverage from Medicare or Medicaid. So we're still working on that, and that's an active issue right now as well. So I'm going to stop here and answer questions. I don't want to overtax or abuse my brief time I've been given, but I'm happy to answer questions if they exist. So thank you very much.
Thank you so much. I'm looking through. Does anybody have any questions? I have gone to Headache on the Hill for the last 2 years, and just for any of you that are on, it is the best experience I think that I have ever had. I come away each year feeling so, I feel like I've made such a difference in the lives of all of us that have migraine and headache disease. So for any of you that feel like you want to participate, I would say go for it. It can seem like it's scary, but it really it isn't. You get training before you go. So I'm not sure if next year is going to be in person or on Zoom, but it's an amazing experience. So hopefully you'll join us next year. But I don't see any questions. Does anybody have any questions? Great presentation. Loved it. And I thank you so much for being with us.
I have a question.
Okay.
If we want to get involved in the Headache on the Hill, how do we do that?
So the person to talk to is Katie McDonald, who is on.
I'm going to speak about that in just a moment, actually.
Okay.
Perfect.
So I do have a question, and maybe we could have it as a brief vote. It's always hard to know how much information is the right level or too much, and how much is too kind of detailed and wonky. And I sincerely am interested in knowing whether or not what I just had to say for the last half hour was too much or too little or whatever. So if you want, you can actually maybe, I don't know, we can set a little poll, or you can contact Katie. So if you don't want me to know exactly who you are, but I'm very interested and open to any critiques anyone has about this, because it's really hard to know exactly, what level of information is useful, particularly for a group that is motivated to give up a Saturday morning to get more information.
That's a great point, Dr. Shapiro, and we would welcome, I will have a survey in the chat box at the very end. And so if everyone will just stay on and complete that, that's the perfect opportunity to share and let us know your specific comments on the level of information on the update. So that's great. Thank you for asking for that, Dr. Shapiro.
Yes, thank you so much. I think it was a fabulous presentation. And we really appreciate all the information you gave us today on Headache on the Hill.